So while we're waiting for everybody to come on, I can introduce myself and we'll just go through a couple of housekeeping items while we're waiting. So my name is Stephanie Goslin. I am the Programs Director with Ovarian Cancer Canada, and happy to be coming to you today. We are presenting this Lunch and Learn series in partnership with Manitoba Cancer Care. This is the third session in our series. And again, just been so thankful for this partnership with Manitoba Cancer Care. I know, Lynda, I believe you've actually spoken with us in person at an event a few years ago. So really fortunate that we're able to work together to provide the most resources. And we were just talking before we started the webinar that it's nice to be coming to you online today because the reach is more. We're able to just reach more people that way, and people are able to just log on for the hour. So really thankful that everybody could join us today. I'm just going to check here and see how many people we have. And a couple more housekeeping. So we are recording the session today. So we will be posting a link in the thank you email that we will send you tomorrow. It will also be posted on our website, ovariancancercanada.org. And also, we really would encourage you to use the question and answer period question and answer button at the bottom of your screen. If you have any questions at all, we are going to leave some time at the end of the session to get to those questions. So we would encourage you to type those in. And like I said, we'll get some time in and ask Lynda some of those questions at the end of the session. So we have today about 37 people who are joining us for this session, and really happy to introduce to you today our speaker, Dr. Lynda Balneaves. So Dr. Balneaves, like I said, she has spoken with us before, and we're really looking forward to your presentation today. She has been a nursing leader for over 25 years in the fields of psychosocial oncology, shared treatment decision-making, and complementary and integrative healthcare. She has published and presented on topics related to integrative oncology, medical and non-medical cannabis, treatment decision-making, and knowledge translation. And I know this is a super hot topic, so I know we're going to have lots of questions. So I'm going to turn it over now to you, Lynda. Thank you so much again for joining us.
That's great. Thanks so much, Stephanie. And I'm just going to get everything set up here. And maybe just give me the thumbs up that everything is looking good. Anyway, great. Yes, fabulous. Really happy to be here. I'm always excited to be presenting to people that are living with cancer, people that are supporting individuals living with cancer. This is the reason that I do this research, and I'm very passionate about supporting people in making informed decisions. You know, if you're here, it means you're thinking about your health, you're looking at alternatives and complementary therapies to try to increase your well-being. So I applaud you for being here, and hopefully some of this information will be useful as you move forward. So let's just jump into it. I got a lot of slides, so I'm going to go through the first half a little bit quick before we dive into the real meat and potatoes, which is talking about specific therapies. I do want to acknowledge, though, that I am presenting from my home today in Winnipeg, which is located on the original lands of the Anishinaabe, Cree, Oji-Cree, Dakota, and the Dene people, and is on the homeland of the Métis Nation. I also just want to make it really clear, because I do a lot of research in the cannabis space, that I have nothing to disclose. I don't accept funding from any industry. I am, though, the Associate Director of the Canadian Consortium for the Investigation of Cannabinoids, which is a nonprofit organization focused on advancing education and science related to cannabis. Let's dive in. So if you're here, you probably know what complementary, alternative, integrative medicine is. But in case you don't, we still use this kind of definition that it's everything that's not considered presently part of conventional medicine. This keeps on shifting, though, as we get more evidence, we do more trials on these therapies. The ones that have positive findings are helpful, kind of get subsumed into conventional medicine, which I think is a great thing. And the other thing, too, is that this is very much culturally and geographically located. When I travel to China, if I travel to India, I see very different therapies being included within conventional care compared to when I go to Europe or if I come across North America. So just putting that out there. The big thing I want you to take from this slide is that complementary medicine, particularly in cancer, is much more than just natural health products, which I know a lot of people have the greatest amount of interest in. But it also includes other therapies, such as body-based therapies like massage, or doing something active like yoga or qigong. It's the mind-body therapies like doing a mindfulness program, relaxation, guided imagery. I've mentioned the biologically based, the natural health products, but there's also the energy therapies, which often arise from more Asian traditions of medicine. So things like acupuncture, qigong is one example. And then lastly, whole systems. Now we have conventional medicine, sometimes called allopathic medicine, but we also have other forms of medicine, some that have existed for thousands of years. So I just want to acknowledge that, traditional Chinese medicine, traditional healing therapies within First Nations and Indigenous cultures, things like Ayurvedic medicine, they come with their own belief system, values, paradigms, and therapies. And just acknowledging, that those therapies have existed and their evidence is often grounded in tradition and history. So in terms of terminology, today I'm going to be using the acronym CIM, which stands for Complementary and Integrative Medicine. I don't usually use the term alternative because it means that we're using therapies in place of conventional cancer treatments. And we don't actually see a lot of that happening. Most surveys suggest maybe 3 to 5% of cancer patients remove themselves from things like chemotherapy or radiotherapy. And that's often when they have a recurrence of disease. But it's very few people. And really what we're moving towards is this notion of integrative medicine, where we're actually taking evidence-based therapies and we're integrating them into our conventional treatment. So we don't have different types of medicines. It's just one big medicine that's supporting people to have the best outcomes possible. Now, for those of you that are coming from Manitoba or even from Saskatchewan and you've received care at Cancer Care Manitoba, we actually completed in 2017 a survey looking at people receiving care over 3 months. What we found is that almost 75% were using at least one type of complementary therapy. So this isn't something that's uncommon. It's actually quite common among people living with cancer. And most people were interested in the natural health products. And surprisingly, under 10% were using mind-body therapies, which are often the therapies that we see being used most often. And if we shift towards gynecological cancers, we don't really have any great surveys here in Canada, but if you look down in the United States, there was a 12-month prevalence survey done. And what they found is that individuals, women that were living with gynecological cancers were much more likely to be using mind-body therapies compared to people that were not living with that diagnosis. And not surprisingly, people that had higher education, which is often linked to income, were more likely to be using these therapies. So, as I said, I'm moving a little bit quickly because I want us to have time also at the end to have some conversation. Now, I always start this presentation talking a little bit about informed decisions, and I'm going to try to give you some tools that will help you, particularly if I don't mention a specific therapy that you may be interested in, but you might want to do some research later on. And it's important that we ask some key questions when we're making decisions about these treatments. And I always start off by saying, before you think about CIM, really think about your foundation. I had this one person come up to me and say, I'm thinking about 20 different natural health products. I'm going to see a variety of practitioners. But then we had a conversation about their diet, and they were eating a lot of fast food. They didn't really have their diet under control. And, there's overwhelming evidence that lifestyle is important, not only in preventing cancers, but also in preventing a reoccurrence of cancer. So thinking about having a healthy diet, exercising on a regular basis, managing one's stress, sleep, and also limiting exposure to things that we know are carcinogenic, such as tobacco or sun exposure. It's really important to have a strong foundation and then add to that if you're interested in complementary therapies. And, you can go and speak to a nutritionist, a dietitian, go to see a trainer to really get good advice about how to safely pursue these lifestyle changes as you're going through the cancer experience and into survivorship. It's also really important to think about why you're interested in these therapies. And, for some, you may be interested in preventing a reoccurrence of cancer or to augment the therapies you're already on. But for a lot of people, it's also about addressing the side effects. Cancer therapies can be quite rigorous. They can have a lot of side effects. How do we manage those? For other people, it's a pivotal moment in their life to reflect on, how has my health been to date? Have I been having that strong foundation? So people look at improving their overall well-being, but also coping with some of the emotional impacts. This is not an easy journey, as many of you probably know and are experiencing. A lot of these therapies can help you in coping with that anxiety that may be associated with your diagnosis and treatment. And reflect a little bit on what you've used in the past and what's been successful, what your values and beliefs are, so that you're looking at therapies that coincide with those beliefs. And you're going to hear this over and over again in this presentation. But when we're talking about recommending therapies and we're talking about evidence, we are looking at this evidence pyramid. And while I honor people's experiences, their stories, they're integral to pointing us towards which trials should be done on what therapies, when we're trying to make recommendations, we have to look at well-designed, rigorous clinical trials, and then hopefully systematic reviews and meta-analyses that summarize several of those trials together. It's our highest quality evidence, and it allows us to be confident in what we recommend around efficacy and safety. And if you're interested in seeing what kind of trials are going on right now, and I did look online and there's not a lot happening at this time, there are some studies out there. You can look at clinicaltrials.gov. It's an international database now, and most individuals that are doing high quality clinical trials on things like gynecological cancers will register their trial there. And you can actually search for complementary therapies to see if there's any type of innovative therapies that are being tested at this time. And I sometimes get particularly clinicians saying, well, there's no good evidence out there, this is all a bunch of hogwash. And I say, well, actually, there are some really evidence-based, credible SIM resources out there, not only for clinicians, but also for individuals like yourselves. The places that I go, number one, is the National Center for Complementary and Integrative Health, which is through the NIH in the United States. They actually have a smartphone app called HerbList app, where you can actually look up therapies to see what research has been done, if there's any safety concerns, and whether it potentially could work for the reason that you want to use that therapy. Great resource, and they're often the major funder of trials in this field. There is an Office of Cancer, Complementary and Alternative Medicine through the National Cancer Institute in the United States, and they do offer some monographs on specific therapies, as well as some advice about how to make informed decisions. I'm the past president of the Society for Integrative Oncology, so this is an organization near and dear to my heart. We're really trying to advance research on integrative oncology, doing research on complementary therapies. We have a very active patient advocacy group. So if this is something you're interested in, we always welcome people to join our organization and come to our conferences. And right now we're really active in trying to expand internationally, as well as to expand the guidelines around using these therapies within oncology populations. And there's always PubMed, which is publicly available, where you can look up the actual research articles. And there's also Google Scholar, which is a higher level than Google, where it again will research the latest research articles. So if there's a specific therapy you're interested in, you can give a search through those databases and see if there's any research that has been published recently. Now, natural health products, again, one of the most popular. My go-to resource, which I definitely have on my phone, is the Memorial Sloan Kettering's About Herbs and Botanical. It's specific to cancer, and they've done basically a summary of the research that's out there. And you can download their smartphone app as well, called About Herbs. Wonderful resource, updated by Gary Gary Deng and June Mao, who are kind of the co-directors of the center there and are great friends and colleagues. The other resource, which is actually available through most cancer settings and through most healthcare institution librarians, is natural medicines. And I call that the CPS for natural health products, very similar to a CVS for drugs and medications. And it basically will encompass all the research that's been conducted on specific natural health products and talk about their safety, contraindications, indications, and then provides links to those research studies. It has monographs that are appropriate for patients, but also for healthcare providers, as does the Memorial Sloan Kettering. It's a great thing to print off and take into a consultation if you want to talk to your clinician about your use of these therapies. And it's a good resource for them to keep in your files as well. You know, through the US, we have the Office of Dietary Supplements, which also has some monographs on vitamins and minerals that might be useful. And just an FYI that we do have a natural and non-prescription health product directorate through Health Canada, which helps regulate our therapies in Canada to ensure that they are safe, and also reviews some of the research attached to them and the claims that are made around specific therapies. If you're buying, though, a natural health product outside of Canada, it will not have gone through the NNHPD review process. And here's just an example of what the Memorial Sloan Kettering website looks like. I picked Chaga Mushroom, which is actually grown on birch trees here in Manitoba and Saskatchewan, that a lot of people are been interested in, but we're still needing more and more research conducted on it. We have better evidence around some of the other mushrooms that are out there, like Coriolis vesicolor or the turkey tail mushroom, which we can talk about a little bit later on. I don't have a slide on it, but if people are interested, I'm happy to speak to it. And if you were scribbling away, this presentation will be available later on. There may also be the possibility of grabbing those slides later on. But our Cameo program, cameoprogram.org, has a link to all the resources I just mentioned, as well as some newer ones. So just don't worry about scribbling them all down. You can just go to cameoprogram.org and look for the useful links. The other big question you need to be thinking about is that if you're doing any type of complementary therapy and you're hoping it's going to work, it's going to have some physical effects. And anything that has a physical effect, it could have potentially a negative side effect, physical or emotional, financial, etc. So it's really important to be thinking about all the sim therapies you're using, not only for your cancer, but perhaps for other health or illnesses. And just for natural health products in particular, there's a few that you really need to be thinking about. And this is where using something like the Memorial Sloan Kettering app or the Natural Medicines database, or consulting with your pharmacist, which have access to all of these databases, are most knowledgeable about it. You know, it's important to have that conversation. We find that a lot of the natural health products can have impact like thinning your blood. So we see that with garlic or willow bark, also used in aspirin. And this is particularly if you're using large amounts of these types of therapies. We do see with some high dose extracts like green tea extract, we've seen some liver damage. And you have to remember that if you're going through chemotherapy, you know, your liver's already working really hard. So you need to have that conversation about whether this additional extract might be safe. You know, most natural health products will have some impact with how drugs are being broken down in our body. A lot of them function through the, cytochrome P450 pathway. An example is St. John's wort, which we've shown has been effective in managing mild to moderate depression, but it also clears a lot of drugs too soon from our body, including such things as birth control pills. So it's important to have that conversation, because when you get your chemotherapy, when you're taking other medication, it's supposed to remain in your body for a certain length of time. And if you're taking a natural health product that's shifting that, you may see more side effects or less side effects. We also sometimes see changes in your blood values, your lab values. So if you're going in for testing, it's important to be thinking, do I need a bit of a washout period for a few days? Again, consult with that pharmacist or maybe your lab folks to see if there's any concerns about you using those natural health products before you get your lab values back, because you want those to be accurate, because it's guiding your treatment moving forward. And lastly, anything, you can have an allergic reaction, you can have an upset stomach, you can have some nausea and vomiting, reflect on, is it the cancer treatments, or could it possibly be any new therapies that you may be using? And obviously, if you're living with other, diseases like heart disease, diabetes, epilepsy, etc., you'll want to reflect on whether any natural health products you're taking could be having an impact on that health condition as well. We often get asked when's the right time to use it. And I think it's important to reflect of where you're at in this journey. Are you in the midst of receiving active treatment? We're getting more nuanced research, where that looks at natural health products being used alongside active treatment. But there's still a lot of concern in the absence of strong evidence of whether there could be a negative interaction. And so we often get the advice to maybe withhold using anything like a natural health products, focus more on things like mind body, energy therapies, while you're undergoing active treatment, so that we don't see any negative interactions that could be making your treatment less effective. But as you start moving into survivorship, if you unfortunately experience a reoccurrence, you may have a different decision-making process that goes on there. You might be finding these therapies are being more focused on things like supportive care. And as I said, you have to think about interactions, but also think about your energy level. For many of you, you may be experiencing, significant fatigue, trying to go to a bunch of new practitioners, trying to engage in maybe a whole, lifestyle change might be quite overwhelming. And you need to be able to, conserve your strength to go through your treatment, but also to do other things in your lives that are important. And just again, if you're looking at some resources to look up, if you're not able to speak to your pharmacist right away, we do have natural medicines. Look at things like tamoxifen, and then it will give you a list of all the different natural health products that there may be some concerns about and what that concern is. And here's just, I'm not going to spend a lot of time getting into this, but we are starting to see this research come out that suggests things like St. John's wort, it could infect things like, cyclophosphamide or tamoxifen or, vincristine. Same thing with the curcumin, same thing with ginseng. So again, conversation is so key, so that everyone's on the same page and they're able to support you in making a safe decision, as well as figuring out the correct timing of using natural health products. And just to speed things up a little bit, the other thing to think about is just the impact of using complementary and integrative medicine on your overall quality of life. Many of these therapies have the potential to improve your quality of life, help manage things like anxiety, distress, sleep issues, etc. But for some people, trying to sort through all these therapies, try to figure out, what to cook, what to use, when to use it, going to multiple appointments, it can have a negative impact on your quality of life and may take you away from doing things that are important, like spending time with people in your life. The other thing to think about is finances, and there is a great deal of financial toxicity associated with using many of these therapies because they are expensive, and we have very limited coverage for these therapies in Canada through our public system. Some of you may have private insurance that can cover it, but do that balancing between what you hope to gain from a therapy and how it's impacting your overall quality of life. And I've talked about speaking to your pharmacist, but I do encourage you, and I know it's not an easy conversation. I've heard from many of you in my research studies that it can be quite challenging, but try to speak to your oncologist about what you're hoping to use and why. Request for it to be put into your chart so that there's a record of it. And if you're struggling with that, ask to be referred to someone that you can speak to. Maybe it's an oncology nurse, maybe it's the pharmacist, and maybe it's your primary care provider. So just try to ensure that the healthcare team is aware. Okay, so if I was in person, we'd stop and have a little conversation, but we're not. So we're going to go right into some specific SIM therapies. Hopefully some of these are ones that you've thought about or perhaps are even using right now. There is some synthesis out there. It's not a lot. If you're interested in things like diet and exercise, the World Cancer Research Fund and the American Institute for Cancer Research have updated their synthesis of food, nutrition, and physical activity research. It is focused on the prevention of cancer, but they've really expanded it in the last few years to focus on secondary prevention. So they're kind of the gurus of what you should be doing in terms of diet and physical activity. In terms of the Society for Integrative Oncology, we do have online guidelines on general cancer patients, lung and breast cancer. The breast cancer is the most current. The lung and the general cancer patients probably needs to be updated. It's about 5-6 years out now. However, we are partnering with the American Society for Clinical Oncology right now on 3 new guidelines on pain, anxiety, and depression, and fatigue. And we really hope that those guidelines are going to be coming out over the next year. I know pain is about ready to be published, and I'm part of the anxiety and depression one, and it's booting along quite well. So our guidelines are going to be publicly available through our website. And here's just a little example of our ASCO endorsed breast cancer guidelines. It's been a wonderful partnership, and it's great to see a major oncology organization starting to embrace and acknowledge these therapies. If you look at this one, and I know we're talking about gynecological, not breast, but a lot of the mind-body therapies are the ones that have the most trials and the strongest evidence. And we're going to dive into some of these in a little bit more detail. So things like music therapy, meditation, yoga, massage. Things get a little bit more questionable when we're looking at things like the energy therapies like acupressure, acupuncture, and we don't have any strong evidence right now in the context of breast cancer focusing on dietary supplements. So the first therapy that I say everyone should be doing, including myself, is mindfulness-based stress reduction. This was developed very specifically with cancer in mind, and it combines mindfulness meditation with hatha yoga, breath work, as well as some homework in terms of kind of self-reflection. And it happens over 8 weeks, and it's supposed to build up this moment-to-moment, non-judgmental awareness so that you're in the now and not thinking ahead or looking back. There's been a huge number of studies done on this. There's been meta-analyses done, and we see a significant improvement in things like anxiety, depression, fatigue, quality of life, as well as it promotes through that reflection process, post-traumatic growth. What's really interesting to me, and we're seeing more studies come out, including here in Canada through Linda Carlson's lab in Calgary, is that we're starting to see positive impact on the immune system. So things like, T cells are starting to increase when people have a regular practice of mindful meditation, which means pretty much every day. We need more evidence on this, but there is some suggestion that as you reduce your stress, your overall immune system could potentially function in a better manner. And here's just an example of a study that was recently done, actually looking at individuals that have undergone oophorectomy. And we did see improvements in quality of life, as well as the management of menopausal symptoms at 3 months and 12 months with individuals that pursued MBSR. So there is some evidence if you're interested in something like managing your menopausal symptoms. A colleague, Lori Brotto at UBC, has also done some research looking at the role of mindfulness in individuals that are having sexual dysfunction issues after being treated for gynecological cancers. And again, they participated in 3 90-minute mindfulness sessions, which isn't a lot better than the 8 weeks. And while there was some positive outcomes, we need a larger study. It was only 31 individuals. So more work is done. And I know that Lori is continuing research in this area. Yoga is another one that's creeping along too. Everyone should be doing it. For those that aren't aware, it combines physical movement, breath control, and meditation. For some individuals, there's a concern that it could conflict with their spiritual beliefs, but often when yoga is offered, in the context of cancer, that spiritual aspect of yoga is often removed, particularly if it's being offered through a cancer center. There has been some systematic reviews focused mainly on breast cancer patients. That's been where most of the trials have been conducted to date. And we've seen, again, very similar to MBSR, improvement in sleep quality, quality of life, and well-being in terms of social and emotional. And there actually has been some research in India with Dr. Rao, who's been focusing on whether it improves things like natural killer cells percentages, which it actually has, as well as seeing improved quality of life and mood. And what was interesting is that it actually seemed to help people in managing their nausea as well, which for people that are trying to avoid using additional medications might be a nice adjuvant treatment. And a recent study was done through Memorial Sloan Kettering with my colleague Ting Bao and her team, where they were doing 8 weeks of 60 minutes of yoga twice a week. Again, small group of women with breast and gynecological cancers, but really focused on anxiety and seeing a significant reduction. So if you have the energy and you're able to, either do it virtually or get into a class in person now, yoga may be really helpful for people that are moving into that survivorship period. What was interesting about this study, and I was talking to Ting about this, is that they were really focused on trying to address chemotherapy-induced peripheral neuropathy. It didn't have a role in actually managing pain, but the anxiety that's attached to, living with neuropathy was addressed through the yoga intervention. Now, acupuncture, this has been a bit of a moving target because we see more and more research being funded through the US on acupuncture. For those that aren't quite familiar with it, it arises from Chinese medicine. It's, from the Chinese philosophy. The idea is that by stimulating acupoints, either through needles or through pressure or through moxibustion, the burning of herbs, you're improving or regulating the flow of qi in the body. The interesting thing is we're starting to do the fMRI studies where we're looking at brain imaging, we're looking at nerve conduction, and we are starting to realize that when we stimulate these acupoints, we're seeing shifts in neurotransmitters, the pituitary glands firing off, and there's a change in how the brain is functioning. So there is a physiological base for it, but we're still teasing out exactly what that is from a Western perspective. We have positive evidence through trials that it could help people with their nausea and vomiting related to chemo, as well as managing their pain. And what's interesting is we're starting to see beginning evidence that's pushing further and further into saying that this is a positive thing around fatigue and peripheral neuropathy. There was a small trial done on lymphedema, but we didn't see positive results, and we might need a larger trial to reach any kind of conclusions. There was a study done, I'm trying to see the date, can't see it right off the top here, by Q, and they found that with a small sample of women with ovarian cancer, they did ear acupuncture, and they saw a 65% reduction in sleep issues 4 weeks after treatment. So not a short-term improvement, whether that's the actual stimulation, of the acupoint, is it because of having that hour of relaxation, lying on the table. That's what we need to, I think, tease out a little bit. There was a more recent trial that was actually conducted by a colleague. Sorry, it was actually 2009, so it's not that recent, by a colleague at Harvard, Weidong Liu, and he was again interested in chemotherapy-induced neutropenia. So looking at something very physiological and whether acupuncture could have a role in that. 21 people, though, is a really, really small study. They did use acupuncture with electrical stimulation, electroacupuncture, and they did see higher white blood counts for people that received the acupuncture. But 21 people is not a massive clinical trial. We need trials with 300, 400 people to be able to reach any kind of conclusions about that. And I don't think Weidong has pursued this any further or is still seeking funding for a larger trial. And then Alex Molosdocius, he's in Hong Kong. He's been doing some research with the team there to look at the effectiveness of acupuncture in managing peripheral neuropathy secondary to chemotherapy. They're doing twice weekly sessions over 8 weeks. They had a slightly larger sample with 87 individuals. And they did see significant changes in pain. They did some neurological assessments that improved as well as quality of life and symptom distress at the 8 weeks. And what was interesting is that at 14 weeks, they still saw improvements in pain and neurotoxicity and functional quality of life. And then at 20 weeks, physical and functional well-being also improved. So, that's important when you have those pins and needles, that you're able to function at a better level. So some suggestion that acupuncture could have a role. This was a weight controlled one, so people were their own control. So there might be a bit of bias in it. But again, hopefully we can start seeing some larger trials and some replication here in North America to see if this is possibly effective. Now, diving into some of the natural health products that you may have heard about that are quite popular right now, one of them is curcumin and turmeric. And it's a very powerful antioxidant. It has an anti-inflammatory effect. And in doing mouse models and test tube studies, they found that it kills a variety of cancer cells. There's also some thought that it prevents blood vessels from feeding a tumor. The problem with turmeric or curcumin is it has really poor absorption through the gut when we consume it. And you usually need to use very high levels of it, which then can cause some issues because it has an anti-clotting effect. So you can end up with bruising, bleeding gums, nosebleeds, etc. Or it has to be kind of attached to a fat or some other chemical like pepperine, which is a component of pepper. And so the problem is that we have a lot of studies right now that are really focused on how to deliver curcumin to the body, so it's actually able to be taken up and potentially have an effect. There's been a lot of cell studies, and there's been some recent ones, 2020, for example, 2019, that shows that when you bombard ovarian cancer cells with curcumin, it does seem to cause cell death. It also seems, there was a study in 2018 suggests it prevents the migration of cervical cancer cells, so preventing hopefully metastases. The issue is that what happens in a mouse model or a test tube doesn't necessarily translate to this complex human body that we have. And so we need to have some clinical trials with gynecological patients around this. Most of the research in terms of using humans has been really focused on advanced pancreatic cancer. So we need to change the focus over to gynecological cancers. The other thing that people are a little bit concerned about with turmeric is it can inhibit certain chemotherapy agents like cyclophosphamide or doxorubicin in breast cancer. And as I mentioned, it can cause some bruising and bleeding if it's used in large amounts. So something to just be aware of. What's really fascinating to me is when I looked through the literature, there's some beginning research, again, with cell and mouse models, where they're hoping that actually curcumin will sensitize ovarian and cervical cancer cells to select chemo agents. So it may have a role in those cells taking up more chemotherapy and more of them being killed off, but we need to move that again into humans before we can reach any conclusions. I'm going to mention ginger. There is some interest in it potentially as having anti-tumor effects, but most of the focus has been on it being an antiemetic or controlling nausea and vomiting. FYI, it also has antiplatelet effects, so it can cause bleeding if it's used in large quantities, not the quantity that you're using if you're making a lovely stir fry. There has been some suggestion, colleague Susie Zick at Michigan, has shown that when it's used with traditional anti-nausea drugs, it does seem to help people in better managing their nausea and vomiting related to chemotherapy. But we've also seen some systematic reviews that have been conducted that suggest it doesn't have a positive effect. So we're kind of bouncing back and forth, and I'll show you a newer one that suggests that it may have an impact. And we saw a small study with gynecological cancer patients that were taking cisplatin, and it didn't seem to help them at all either. So something that we need to kind of explore in greater detail. And one caution beyond the bleeding and bruising is it also impacts your blood sugar levels. So if you're diabetic, pre-diabetic, or are having your blood sugars checked, it's something that people need to be aware of. So there was a study that was fairly recently done. Oh, it actually was very recently done, 2021, where they looked at the effect of a ginger tea, where they were brewing 250 milligrams of the ginger root in boiling water, and people were getting 4 cups daily, 4 cups daily, and they were taking those every 6 hours. So 1 cup every 6 hours. And what they found is that people did report lower retching, less nausea and vomiting in the group that had the ginger tea. So if people aren't able to take, the anti-nausea drugs or having some side effects from them, ginger tea potentially could have a role, but you maybe talk to your pharmacist or a dietitian to make sure that's a safe way forward. So I get a lot of questions about mistletoe. It's also called escador in Europe. We see it being used a lot in Germany, and there's actually a very large trial going on right now in Stockholm with my colleague, Katrine Wood. Katrine hasn't released the findings yet. She's just in the middle of analysis. And I can't remember if it was breast or if it was also including gynecological cancers. But, again, the mouse models suggest it does kill cancer cells in vitro and may potentially enhance our immune system. But what have the clinical trials told us? Most of the trials have been conducted in breast cancer patients. It's been more than 30. While they've shown positive outcomes, there's been a lot of criticism about the design of those studies in terms of sample size, blinding, and whether there's some bias been introduced. There's actually been 2 recent systematic reviews that have been conducted from Europe that didn't find any impact on survival, quality of life, or symptom management benefit. But because of the earlier trials, we still see new trials coming out. So hopefully there'll be a few more. The thing is that mistletoe can be quite toxic. You should never eat the berries, the leaves. It can be quite poisonous. And it can really cause allergic reaction. And we see people, it's given sub-Q, it can cause redness and swelling, and people can also have fevers and chills attached to it. There was a small study that was done. They had 71 women with ovarian cancer. The rest were people with lung cancer. They had mistletoe injected 3 times a week. They did find improvement in terms of quality of life. They also found that people expressed that they had less, they didn't have serious side effects. This was compared to another phytotherapy that's popular in Germany. But again, 71 women, it wasn't a lot, and they didn't pull out an analysis that was specific to ovarian cancer. There's been a more recent study, though, that's looked at using mistletoe in cervical carcinoma in situ. And this was just a single case study, though, that was done by a colleague, Gunvor Knil. One case, it's important. Their experiences are very valid, and it gives us direction of where we should go with our clinical trials. And while we saw remission in this case, you can't exclude that there may have been other reasons, or it could have been a spontaneous remission. So, the conclusion from this, from Gunvor's perspective, is that we need to do more trials that are more rigorously designed to see if mistletoe could have a potential impact, and whether it could also be used alongside chemotherapy agents. IV vitamin C, it's been around forever, and we keep seeing people, talk about it. And we've seen a little bit of resurgence in the last few years of research on it in terms of, does it have a role in cancer treatment, or does it have a role in stimulating cancer cells to be more susceptible to chemotherapy and radiation? It's a water-soluble vitamin, so we often sometimes say it's the most expensive, injection you'll get or IV, because it could just get flushed out of your system. The idea is that by having high doses through IV, you'll get that higher level that's needed to see an impact. There's been a lot of studies in the early 2000s that suggested that it didn't have any impact on survivorship across different cancer populations, but people tolerated it quite well. And in fact, we saw some improvements in palliative care patients related to their quality of life and their symptoms, which could reflect the vitamin C, but it could also reflect just receiving additional fluids through an IV route. There's also been some work suggesting that it reduces the toxicity of chemotherapy, but then I've had some oncology colleagues say, well, there's less toxicity because as a powerful antioxidant, could it be making our chemotherapy less effective, less cancer cell death, and thus people aren't seeing the same type of, nausea, vomiting, pain, etc. But because it's a powerful antioxidant, when we use it alongside chemotherapies, is it making it less effective? So there's a lot of questions out there, but there has been some recent studies that I think might be of interest to this group. The other thing is that if you have any type of kidney issues, there needs to be some caution because it can cause kidney stones. And there's one small study suggesting that it could increase the risk of liver cancer, but it's hard to know, from that small study if this is something that, needs to be a widespread caution. There was a recent study done, it wasn't the best designed one that I've ever seen, where they combined doing a mouse model study with a clinical trial. And so with the mouse model, they were looking at the role of IV vitamin C with and without chemotherapy, focusing specifically on carboplatin and paclitaxel. And they looked at this across 8 different types of ovarian cancer cell lines. And they saw positive results in terms of the cancer cells dying with just the IV vitamin C. And then they also saw that it seemed to have a synergistic effect with the chemotherapy agents, and more cancer cells and tumors were being reduced in size. But again, mouse model. So they did a phase 1 trial with 27 individuals, very small again, and they saw a reduction in toxicity related to chemotherapy, but they didn't follow these people long term to see if there was any impact on, tumor growth, migration of cells, or survivorship. So again, further research is going to be needed. It's been a while since this was published, so I'm not sure if they've pursued this line of inquiry. And I wanted to kind of wrap up talking about one of the really popular diets that are out there, ketogenic diets, which everyone's been on, including myself. It's great for losing weight. And there's been some suggestion it can help people that are pre-diabetic or even with diabetes in getting off of some of their medications. It's a very high fat diet. Most of your calories are coming from fat, and there's very limited glucose and carbohydrates. If you speak to a dietitian, there's often a lot of concern about this diet, particularly if people use the, butter, bacon, fatty cuts of meat, in terms of just the possible risks of consuming that type of food, not only on your heart health and related markers, but also in terms of not getting fiber. And we often see people having some real GI issues in consuming that type of diet. The whole idea is that by removing kind of a source of sugar from cancer cells, you're kind of causing this, and you go through that ketosis, you kind of create this oxidative stress to cancer cells. And the idea is that it's going to make them more sensitive to chemotherapy and radiation. We're really just starting to see the trials come out on this. We've seen a trial with glioblastoma, brain cancer. We've seen a focus on advanced cancer patients. And everyone seems to tolerate it quite well with little side effects, but often you're not using this as an intervention for more than 8 weeks at a time, which, what are the long-term impacts, beyond cancer, haven't really been tested yet. We're just starting to see the research on gynecological cancers and ketogenic diet. And I found 2 that came out from Caroline Cohen, which did a small trial with 45 women, looking at women that had ovarian or endometrial cancer. And this was self-report, which again, very valuable data from the women themselves, saying that they had improved physical functioning, their food cravings were reduced. We saw a significant weight loss. 2 to 3 pounds is what we're talking about, compared to people that weren't on the ketogenic diet, and their insulin levels were improved. So we need a lot more research on ketogenic. I think we also need to do a lot more work on creating healthy ketogenic diets. And I've given an example of a plate where it's, an ocean fish. I think it looks like swordfish or tuna, with avocado, with some guacamole, and then some low, carb vegetables like green beans, salad, maybe some looks like some pickled onions there. So, not doing the bacon, all you can eat bacon ketogenic diet, but choosing one that's more Mediterranean based. So you're still getting those healthy fats and still having low carbs. So much more work to come. And just to wrap things up about therapies, I'm going to stop with cannabis, which, is an area that's near and dear to my heart in terms of my research program. As I'm sure you've all heard about, there's growing interest, pardon the pun, on cannabis. It's a very complex plant therapy. It has more than 130 cannabinoids, with most of the focus right now being on THC and CBD. And we really are just at the beginning stages of doing research with cancer patients and doing clinical trials. There's some thought that there's some benefit, particularly in the context of symptom management. So managing pain, looks like THC and CBD may both have a role. CBD may have more of a role with neuropathic pain. It could help with nausea and vomiting, particularly THC, although it's a double-edged sword, because if you take too much THC, sometimes people get hyperemesis syndrome, where they can't stop throwing up and they think it's the chemo or the cancer, and really it's the THC. And there's beginning suggestions. We haven't really focused on cancer patients yet, more in veterans with PTSD, but that CBD may help people with managing their anxiety and traumatic stress and things like night terrors. We're starting to see some beginning lab research because we know the endocannabinoid system that we have in our body has a role around the development of our sex organs. So the thought is, could it also have a role in managing, gynecological cancers? There is one group that's been looking at the anti-cancer effect, primarily CBD on cervical cancer, which did have some positive effects. But again, lab study. So what does that mean for us as humans? I always need to point out that cannabis isn't a benign substance. It has a pretty high safety profile compared to most substances. But for some people, getting high is not a good experience. If you already have motor coordination issues, you have risk of falls, you have to be careful with using cannabis, particularly high in THC. Dry mouth, impairment of memory and concentration. And you have to balance using cannabis, against other substances or other medications that you might be using to manage your symptoms, because you don't want to, while it doesn't seem to have much of an interaction with opioids, it may have an impact on things like anti-anxiety medications. And you don't want to be completely zoned out because you're doubling up on effects. There's been, again, some beginning interest in the role of cannabis. This is a 2020 article that actually surveyed women with gynecological cancers. And they did find that 41% reported an improvement in neuropathy. So definitely pointing us to perhaps do a clinical trial on the role of cannabis. And they also said that for those that were using it for pain management, 63% reduced their opioids. And I think that's the interesting thing with cannabis is not only may it help in managing symptoms, it may also help reduce the use of problematic, medications like opioids, where we do see some people unfortunately develop a dependency or an addiction. And also all the side effects that go with opioids, like constipation, and again, issues with coordination. So it'll be interesting to see where this research goes. And I just, want to end to say that, this is a moving target. There is new research coming out all the time. I did a quick little boo this morning to see what's new. Again, we're seeing a lot of mind-body therapies focused in the context of gynecological cancer, but things like laughter therapy, reflexology and aromatherapy, music therapy, and then my colleagues in Israel, Aaron Ben Er and Noah Samuel, are actually focusing on creating kind of a comprehensive integrative program and seeing improvements in people's overall quality of life, as well as things like sleep. So I think there's a lot of room to do research. We're seeing, our own Canadian Cancer Society wanting to do research on more uninvestigated cancers. So hopefully we'll take the focus away from breast and start focusing more on things like cervical and ovarian cancer. So just to kind of wrap up, a lot of the research is at the beginning stage, particularly in the context of gynecological cancers. So it's important that you start using a therapy, that you stay current and see if any new studies are coming out, if there's any new information through some of the resources I presented. Make sure you consult your healthcare team. I recognize that not everyone is a big supporter of complementary therapies, but I think it's important that they know what you're using for your own safety, and so that they're giving you appropriate advice. And make sure that when you're thinking about using these therapies, that you're weighing the pros and cons, and make sure that, using these therapies aren't negatively impacting you, particularly your quality of life, or perhaps even those around you. And, as I keep saying, lifestyle choices are kind of a foundation for your overall well-being, living with and beyond cancer. So if you're looking to start, down this journey of using complementary therapies, perhaps first kind of look at your diet and exercise and other lifestyle choices, and get that strong foundation, as you launch yourself into using different ones. So I've got about 9-10 minutes for questions. So I'm going to sign off. I'm always happy to get questions if you have anything. I can't answer every question, but I can give you the latest information that's out there. So I'll just end my show.
Awesome. That's great. Thank you, Lynda. So important, I think, to revisit this subject. I know I said at the beginning that you had spoken with us before, and I think it's so important. As you mentioned, research is coming fast and furious. So it's so important that we revisit this subject all the time to continually stay on top of everything. So thank you again. Yeah. We do have several questions, so I'm going to get right into them here. Now, the first question comes back to something that you talked about at the beginning of the presentation. And the question was, and I can't remember what you said, but does this mean drinking green tea can harm our livers?
No, when I talk about green tea extract, it's a very concentrated form of several of the components in green tea. So, and using it in large dosages. And that's why it's so important when I talk about things like, ginseng or garlic, that, often when you're consuming it as part of your diet or incorporating it into your food, it's not at a level that there's concerns about. It's often when you're using mega dosages, so well beyond recommended dosages that are on a label, or you're doing things through an IV route, or you're using an extract or concentrate. That's when you need to start being a little bit more mindful of how much of the active component am I getting here. If you're using something that has, like a greens plus, and it's got, a long list of things, and then you're using a few other kind of supplements or things, you need to look across each of them to make sure you're not doubling, tripling up on the same component. So, green tea is quite healthy. There's been a ton of research, especially from Asia, saying that it could potentially prevent certain cancers. The thing with green tea is I've seen people take like 10 cups a day, and then all of a sudden they're jittery as all get out, and they forget how much caffeine can be in green tea. So if it's just drinking it, you should be fine. If you're drinking, 10 plus cups a day, you might want to just pull back a little bit on that.
Okay, makes sense. Thank you. Next question here is, how do we go about finding practitioners who provide acupuncture for symptom management?
Yeah, and that's a tricky one. And I know that, as being president of different organizations, we get asked to put up like a directory. And, my suggestion is, one is you first talk to your healthcare team, because they may have someone that they've worked with, or that they have. Yeah, Nora always likes to join me when I'm talking on a webinar. They may have some advice of someone that has gone to that acupuncturist. They may have had a correspondence with a certain acupuncturist. So that's one suggestion. Acupuncture Canada is a training program for conventional practitioners. They may also have a list of individuals in your region that are qualified to provide acupuncture. They're typically physicians, or physiotherapists that have gone through that training that may be able to offer it. every province is different in terms of how they're regulated. And I'll have to be honest, off the top of my head, I can't remember because I've been moving around the country of where Manitoba is at. You should ask if they are a member in good standing. They typically are part of an association of traditional Chinese medicine practitioners. You should ask if they're a member in good standing. You should check with that association. And you should also see if there's anything provincially about that individual. I always ask someone if they receive training in cancer. There are specific training programs for, naturopathic physicians that can provide acupuncture that is specific to oncology. And you may find, a traditional Chinese medicine practitioner that has done some specialty training in oncology. You want to make sure that they're aware of what you're using in terms of your chemotherapy, radiotherapy, and surgery. And that, if there's any contraindications, there's a communication between your healthcare team and that individual. So it's a bit of a Google search, but I would suggest looking for associations first, like Acupuncture Canada. Check to see if there's a traditional Chinese medicine association in your province, and contact them to see who's in good standing. And then have that interview with an individual about your cancer treatment and your type of cancer, and see if they have any concerns and if they have specialty training. So.
Okay, excellent. Thank you. We've got a few more rolling in here now. I cannot smoke cannabis products at all. I haven't for years. Even one puff and I threw up for days. Is cannabis something that I can still consider? Because I know you mentioned that the THC being possibly the culprit here, so she would avoid that and try others. She hadn't even thought about this because she was so worried about the side effects.
Yeah, and you know what? We're still unpacking a lot of it. For THC is causing the nausea and vomiting. All different consuming cannabis now, and it also depends on what you're using it for. CBD may have a different role than THC. So depending on what you're using it for, if you're more focused on CBD, you can get strains that have very little THC in it, and you can get something like an actual capsule of oil. Or you can we even have oral strips now, or you can put a tincture under your tongue. And one company has just come out with suppositories. So there's a lot of routes of taking it that aren't inhaled any longer. And if you think THC is causing nausea and vomiting and CBD would be appropriate for why you're using it, you probably can find some other options for you.
Okay. Thank you. Next question. I'm interested in hearing about turkey tail mushrooms. Safe or not safe during chemo treatment, or once chemo treatment is done? I have read conflicting information on that.
Yeah, there hasn't been a ton of trials here in North America looking at turkey tail. Most of the research has been in Asia, where they actually take the polysaccharides out of the mushroom and it forms PSK or PSP. And so it's an extract. They do use it alongside various chemotherapy agents in Asia. I just haven't seen research to really look at, having a clinical trial that shows people with it, without it, and then looking at, whether it impacts the effectiveness of chemotherapy. I know it's integrated, as I said, in chemotherapy and conventional care in Asia, definitely not here. I think you need to sit down and have a conversation with your pharmacist to see what their concerns are. It doesn't have the same antioxidant effect as a polysaccharide, but they may still have reservations. So it might be something that you use in between your chemotherapy treatments with a washout period, or it's something that you wait for your survivorship period to engage in. So, and I know I'm glad you love the pet therapy. She hasn't been this active for the past 3 weeks, but here she is today.
She's providing us a little bit of entertainment.
Little entertainment.
I have 2 final questions, and we're getting comments even now. She's the cutest kitten ever. So there you go. So thanks for making an appearance in our lunch and learn. I have 2 final questions. What do you think about drinking kombucha?
As I have it on my side of my desk.
Okay.
Kombucha is interesting. Chaos, kitty. If you're having some GI symptoms, there's some thought that kombucha may have a role, or things like kimchi or sauerkraut may have a role in helping preserve our flora or repopulating our gut flora. We're learning more about how important the microbiome is for inflammation and perhaps mental health, etc. And chemotherapy can do a number, same as radiotherapy on our natural flora. That being said, I haven't seen any trials yet on kombucha. You would want to make sure that you're getting it from a reputable source. If you're making your own, you need to make sure you're doing it in a very rigorous manner, because your immune system will be compromised during cancer treatment. And you just want to be careful if you're getting kombucha from a source that may not be that reputable, that you could end up with some worse problems drinking it. So I think it has a role. I think it's a delightful drink, but this is where talking to a dietitian might be wise. There's a lot more research on the microbiome, but they're doing more things like fecal transplants and not so much focusing and probiotics, and not focusing so much on dietary changes like drinking kombucha. But, yeah.
Okay. Yeah. Final question. Any feedback on alkalinity versus acidity in gynae cancer?
Yeah. So, I know that we have all these alkaline, waters and diets. I'll be honest, our bodies are amazing in preserving its homeostasis. And so if you are dramatically changing the alkalinity or acidity of your body to try to treat your cancer, you're going to have some severe side effects, because our body is pretty good at maintaining its pH level. So we haven't seen any research with humans to suggest that it has any role in gynecological cancers or even other types of cancers. And I really caution people to dramatically trying to change their pH, because you will have other symptoms and side effects that are not going to be enjoyable. So right now, there's no evidence. I always leave the door open for that RCT that changes our mind. But I wouldn't recommend it at this time. And if you do something like this, you should do it under the supervision of a dietitian to make sure you're not harming yourself.
Okay. Thank you. Great feedback. Okay. So that is all of the questions that we have for today. So I wanted to thank you again so much, Lynda, for sharing your time with us, your experience and your expertise. I know that this is a topic, like I said, we get a ton of questions and there's so much new research coming out all the time. So we really appreciate your input and your feedback on that, as well as your expertise. Before we go, we have one final session in our Lunch and Learn series, and that is next Tuesday, May the 31st. And that is pelvic radiation-induced bladder and GI side effects. Our speaker next week will be Dr. Saranya Kakumanu. And the other thing is you will get a link for that if you've already registered. Please check your spam folder. If you don't get the link, it might have gone into your spam folder. And finally, everyone, thank you again for attending. But your feedback on all of these presentations is so valued and important for us. It really helps us to shape all of the future events that we do. So if you could take a couple of minutes, I know Michelle has posted the survey evaluation link in the chat box to the right. You also will receive an email from us tomorrow with that link in there as well. So if you could take a couple of minutes of your time to fill that out, it would be greatly appreciated. And on behalf of all of us here at Ovarian Cancer Canada and Cancer Care Manitoba, we want to thank you again for joining us, and have a great rest of your day today. Bye-bye.